60 years old Mr. John come to your
Mm-hmm.
clinic.
Mm-hmm.
Take history, do relevant examination, and manage the patient.
Okay. Start.
Let me put a stopwatch for you. As it is a 10-minute OSCE is exam scenario. Okay, I will stop once the time is over, and I will inform you 2 minutes before. Okay, your time
Okay.
starts now.
Hello, Mr. John. My name is Dr. Asba. How can I help you today?
Yes, doctor. I am having some kind of cough.
Mm-hmm. I'm sorry to hear that. Please, Mr. John, tell me more about this.
Yes, doctor. Since maybe last 6 weeks, I am having cough, and I have also difficulty in breathing when I am sleeping in the night, doctor.
Mm-hmm. Mm-hmm. Okay. Okay, Mr. John, may I know a few more questions for the better understanding?
Yes, doctor. Why not?
Okay. As Mr. John, you told that you have a cough from last 6 weeks and along with the difficulty in breathing. Before that, you were okay?
Yes, doctor.
Mm-hmm. Okay, Mr. John, tell me more about your cough. What type of cough is this? Is this dry or wet?
Yes, doctor. It is some kind of sputum is coming, and I find out some kind of redness, somewhat like that on the sputum.
Okay. And Mr. John, can you please tell me what type of redness? Is this small, only little amount, or all the flame covered with redness?
Doctor, little amount only, and also sometimes, not every time.
Okay. Okay. And as you told that you have along with this the difficulty in breathing, is it is on walking or only on lying down?
Doctor, it's sometime all the time, and sometime when I get little more exertion, it becomes worse.
Mm-hmm. Okay. Along with that, is there any chest pain?
No,
Have you noticed any change in your unintentional weight changes?
doctor, I guess somewhat like 2 kg I have lost.
Okay. And is there any fever?
No.
Okay. Any nighttime sweating you have?
Yeah, doctor, I noticed probably maybe last 15 days before I got up from my sleep and my shirt was full of water like that. Then I had
Mm-hmm.
to change that one.
Okay. And do you have any swelling in your foot?
No,
Okay. At night time, how many pillows you take for your sleeping?
no.
No. Okay. And do you travel 6 weeks before?
Yes, doctor, I went to Nigeria for my business trip and I stayed over there in a hotel for probably
Mm-hmm.
maybe 14 days.
Okay. And this one, how many times before you travel?
Yeah,
How
doctor,
much
probably
time?
maybe this was 2 months back.
2 months back. And is there anyone there have a similar problem, similar cough? You have anyone exposed?
Doctor, I don't know because we had a public dealing over there and we had lot of meetings over there and we had to
Oh.
go to the remote areas also. So, yeah, yeah.
I can understand. Okay, Mr. John, may I know do you have any long-term illness apart from this, like high blood pressure,
No, doctor.
high blood sugar?
No, doctor.
Okay, any long-term chest problem before you have?
No, doctor.
Okay, in your family, anyone have similar complaint, similar
No,
problem?
doctor. No, doctor.
Okay, are you taking any medicine these days?
Doctor, I take only some painkillers for my knee pain.
Okay. For your knee pain, which one, which medicine are you? Do you remember?
Doctor, maybe it is 400 milligram. It is Brufen like that.
And
Yeah.
how many times you are taking and from how long you are taking this?
Doctor, I am taking for 5 days if pain is there. Otherwise, I am not taking.
Okay. Is there any tummy pain you have on and off?
No,
Okay. Do you have any medicine allergy?
no.
What do you do for your living?
Doctor, as I told, I am a businessman, so I went for this business trip, doctor.
Okay, and everything is fine in your business? Any stress these days?
Fine, doctor.
Okay, with whom you live at home?
Doctor, I live with my wife and three kids.
Mm-hmm. Okay, and do you smoke?
Doctor, somewhat like in politics, I am not hiding from you.
Okay, occasionally you smoke. Okay, Mr. John, smoking is you know the hazard of smoking.
Yes, doctor. So
Okay.
many times I also attended meeting. Also there we have discussions also. But others also take smoking over there, doctor.
Okay, please, Mr. John, we will take a separate session over it. Please think about to complete quitting. Okay.
Okay, doctor.
Okay, and do you drink alcohol?
No.
Okay. Do you know weight according to your height?
Doctor, probably it may be I am 72 kg now.
Okay. And what about your diet?
I take all kind of diets, doctor.
Okay. Are you taking any physical activity these days?
No, doctor, I am 60 years, so I feel
Mhm.
tired when I go for outings.
Okay. But are you able to do your daily chores?
Yeah,
Daily.
doctor, I do by myself everything.
Okay, that's nice. And do you have idea what's going on with you?
Doctor, I don't know, maybe some kind of chest infection. Give me some antibiotics, doctor.
Okay. And what particular worries?
Doctor, I'm worried that if this cough will stay like this, I have difficulty to continue my business meetings, doctor.
That's the valid concern. I will talk about it. And what you want from me? I accept the antibiotics. The other expectation from me.
That much, doctor.
Okay. And this condition is impacting your life these days?
Doctor, in meeting, as I told that coughing in the
Mhm.
meeting is
Mhm.
yeah, everybody feels like bad.
Mhm. Okay. Let me summarize, Mr. John. As you told us, you have a cough from last 6 weeks, and along with difficulty in breathing, and you are difficulty in attending your meeting, and you want antibiotic from me to continue your work. Anything else you want to add?
No, doctor.
Okay, Mr. John, may I examine you?
Yes, please, doctor.
Okay, in the first I will hand sanitize and in the presence of full privacy and chevron, I will check your vitals, pulse, blood pressure, respiratory rate, temperature, and oxygen saturation. Then I will do the general physical examination. I will check your hands for any tremors and any pallor and all of this. I will check your eyes, then mouth for cyanosis, then lymph nodes. I will check in your throat, neck, lymph node, and please unbutton your shirt. I want to check your chest.
Yes,
Okay.
doctor.
Okay, during this, Mr. John, I will look at your chest. You will touch your chest and listen to your chest with the this stethoscope. Okay. During my checking, if you feel any pain, please let me tell or let's stop there. Okay. So first I will look, then I will touch your both side of chest, front, back, and chest expansion. I will check. Then I will listen three areas, front and back, and
Two
I will
minutes
check the.
left.
Okay. Okay, as Mr. John, as you told me after listening you and examining you, I'm suspecting that you have a problem which we called in the medical term is a tuberculosis. Have you
Open
ever heard about this?
open card number 172. Oxygen
Okay.
saturation 92, blood pressure 130 by 80, and bilateral chest cramps on the apical zones. Okay. Yeah.
Okay, Mr. John. It is a condition. It is which in which bug enters our lungs and cause infection. Okay, so I want to do some investigation for you. I will do chest X-ray. Okay, and so sputum early morning sputum three
Open
samples
card
I will take.
number open card number
Okay.
160, chest X-ray.
Okay,
Okay.
I will check HIV and okay, I will do all this. I will check HIV, your HIV testing. I will LFTs, serum or kidney function test, and gene expert for MPTB and rifampicin. Okay, Mr. John. So I'm starting you some medicine. This is a new medicine. No, we are following new regime. 4 months. It's a good news that there is a short duration of medicine for this. Okay, so 4 months time medicine, four medicine you will first take two, and 2 months and then 2 months. Are you getting my point?
Yes,
Are you
doctor.
with me?
Means I have to take four medicine for 2 months.
And yes, you will take four medicine for 2 months and then three medicine for the next 2 months. Okay,
Which
this
one,
is
doctor?
isoniazid, rifampicin, pyrazinamide, and moxifloxacin. Okay, these are you will take it, and I am also after your coming final PCR and report, I am also register you the dot therapy. Okay, so we will observe you and help you to continue this medicine regularly. Okay, and along with that, I also
Time is over.
okay. Okay.
Okay, Dr. Asba, very well done. You started your case from the good beginning. You started to introduce yourself with the patient to build the rapport. You ask the patient and confirm the name and age of the patient. And as far as the data gathering and consultation is concerned, the consultation you did properly and you explored most of the things in the consultation. And the main symptom of the patient was cough and difficulty in breathing. And the cough, the sputum was explored very nicely. You try to ask from the patient some questions for the differential diagnosis. That is really very, very much means helpful for the candidate to pass the examination. And you try to ask from the like you differential diagnosis for pulmonary embolism and I guess for asthma, COPD, and you try to rule out those cases. This is very much necessary. You try to ask some red flags. Okay, that was great from your side, and you took the drug history from the patient also, and you also take the family history from the patient. That is very nice. Social history was also taken. The idea concerns were taken from the patient, and investigation were very well done. Examination was well done, but in the management, you need to improve here because you took 6 minutes for your data gathering. That you should minimize up to 4.5 minutes and give your 3 minutes to examination and 3 minutes to your management. And also, you should tell the patient that counsel about the TB, how the patient got TB, and you have to ask from the patient that what was happened to the patient, how this happened to the patient. You have to mention all of the things in a simple and paraphrased way. Okay. And furthermore, I should add here that you should ask the patient, is it okay for you? Is it all right? And this is the patient centeredness because the management should be patient centeredness. Patient should be involved, but not like that only the doctor is trailing and completing his or her case in 10 minutes. So if you want to complete the case, please be careful in the data minimum, maximum of 4.5 minutes. This was all the case for my side.
Okay. Yes, तो आपने recording